If you have swelling and lymphedema in your breast, chest, or the trunk area, this lymphatic massage video is for you. I'm going to guide you step by step how to do a complete manual lymphatic drainage routine for your breast or chest to get that fluid out of the area and get you feeling better. Make sure you check out my channel for other videos on lymphatic massage if you need it for a different part of your body. I'm Alex Hill. I'm a physical therapist and I specialize in oncology and lymphedema. I'm also a certified lymphedema therapist and I specialize specifically in cancer rehab. Make sure to subscribe to my channel below for more videos on how to manage your lymphedema and other cancer concerns. Manual lymphatic drainage, or MLD, is used to help decrease the swelling from lymphedema. Before you start any type of new program, including MLD, always check with your medical provider first. While you're doing MLD, if you feel shortness of breath, chest pain, heart palpitations or fluttering, or something just doesn't feel right, stop immediately and contact your medical provider. I'm going to show you how to do this lymphatic massage for the left breast or chest, and you can follow along with me and make sure you're doing the right side by following the pink wristband on my watch. But if you have swelling on the right side, follow along with the video up top once the movements change. The first part of this lymphatic massage is going to be the same regardless of what side you have your lymphedema on, and I'll tell you once it starts to change depending what side you have your swelling on. Regardless of what side you have the lymphedema on, you're always going to start with the same thing, which is diaphragmatic breathing with a little bit of pressure. So you're going to sit in a comfortable chair, hands on your abdomen. You're going to breathe in through the nose, pause, and breathe out through the mouth. As you breathe out, you're going to gently press your hands into your abdomen at that belly button. This deep breathing and that gentle pressure helps to stimulate that central part of the lymphatic system where most of our lymphatics are. So let's do that 4 more times, so a total of 5 times just centrally at the belly button. You're going to breathe in through the nose, fill up your chest, your trunk, your abdomen, breathe out through the mouth, give some gentle pressure in, breathe in through the nose, out through the mouth, give that gentle pressure. We've got 2 more breaths here. Breathe in through the nose. Fill up that chest and abdomen. Breathe out through the mouth. Gentle pressure into that abdomen. We'll do 1 more breath here. Breathe in and breathe out through the mouth. Go ahead and give that gentle pressure in. If you have pain with giving pressure into that abdomen, you don't need to give pressure. Still just really focus on getting nice big movements into the chest and into the belly with that diaphragmatic breathing. Next, we're going to do this in 4 other places. So as you can see, I have my belly divided into 4 quadrants. So we're going to take those deep breaths and abdominal pressure in each of those quadrants. So starting at the left lower abdomen, go ahead, place your hands there right above the hip bone. Breathe in through the nose, out through the mouth, and give some pressure into that lower abdomen. Breathe in, move your hands to the right lower abdomen. Breathe out as you give that pressure in. Breathe in through the nose. Move your hands to the right upper abdomen, just below the ribs. You're going to breathe in and breathe out. Give that pressure down into the abdomen. And then the last place, the left upper belly, right below the ribs, you're going to breathe in and breathe out. Give that pressure down into the abdomen. If you have a lot of swelling in the trunk area, if that felt really good to do for yourself, go ahead and repeat those 4 quadrants a couple more times. So pause the video here, do those 4 quadrants, and then once you're done, go ahead and hit play, and then we'll continue with the rest of the massage. So now that we have the central part of the lymphatic system stimulated, we're going to move to the neck where we have more lymph nodes and lymph vessels. So you're going to take the pads of your fingers, not the fingertip, the pads of your fingers, place them right behind the collarbone in that dip. You're going to do a circular motion going towards the neck, and you're going to do that 8 to 10 times. If this is challenging or hard for you to do with both hands at the same time in this position, you can cross your hands and do that same movement. Or if you prefer to do just one at a time, you can just do one side first and then do the other side. I prefer to do both at the same time. I feel like I can just get a little bit more done, but whatever way you choose, we're gonna do that for 8 to 10 times right behind that collarbone. Next up, we're going to work on the lymph nodes that are around our ears. Again, we wanna open up this entire area to help get that fluid back into the system. So I like to take my fingers and separate them like this. Bonus points if that made you think of Star Trek.
Live long and prosper.
You're gonna take them in front and behind your ear, and you're going to do nice, slow circles in front and behind your ear. Again, you're going to do that 8 to 10 times, just like we did at the neck. It should be nice, slow movements. And then after you do 8 to 10 times on one side, then you're going to do the same thing on the other side. Separate your fingers, and you're going to do those 8 to 10 circles behind the ear. After you finish the ears, then we're going to start moving down the neck. So regardless of what side you have the swelling on, we're going to kind of wake up the lymph nodes in both armpits. So these are going to be the areas that we're moving the swelling to are the armpits. The third place is actually going to be the groin on the same side that you have the swelling. Because you have swelling in this area, so we'll say on the left side, remember, follow that watch band. We're moving that swelling out of that area to the right lymph nodes in the armpit, and we're moving them down the left side of the trunk to the left groin. Now, what we know in the research is that even if you've had lymph nodes removed or you've had radiation to that area, the lymph nodes and the lymphatic system can still take up fluid in that affected side. So we still do want to wake up and work on those lymph nodes on the area that you have the swelling. So I'm going to do the left armpit first. You're going to take your fingers together, use the pads of your fingers, place them directly in the armpit, and you're going to do kind of a circular movement directly in the armpit. Just like at the neck and at the ears, we're going to do this 8 to 10 times. And you notice that the movement that I'm doing is pretty slow. So we're not rushing through this. We're not going super fast. If you do this more than 8 to 10 times, that's fine. 8 to 10 times is kind of the minimum. Once we do one side, we're going to the other side. So again, fingers together, place them directly into the armpit, and we're doing those 8 to 10 circles. And again, regardless of what side you have swelling on, we're working on both armpits. So nothing's changed yet, but the next part of this massage, if you have swelling on the right hand side of your body, so swelling on the right chest or breast, make sure that you follow the video above. That is going to go through the movements on the right side. Otherwise, if you have swelling on the left breast and the left chest, we're then going to wake up the lymph nodes in the left groin. So taking again, flat hand, you're gonna place your hand in the crease right where your hip bends, or kind of right at the underwear line. You're gonna place flat hand, and just like at the armpits, you're going to be doing 8 to 10 circles, waking up the lymph nodes on that side in that groin. And we're doing those nice slow movements just like with everywhere else. Now, as we start to actually move the fluid on this next part of the sequence, this is best done skin on skin. So I'm doing it over my shirt, but when you do this at home, make sure that you're doing it skin on skin. That's gonna give you the best outcomes. All right, so we just woke up the lymph nodes in the groin. Let's go ahead and start to move that fluid down the trunk. Take your hand, make sure it's flat, a little bit rounded like this. Fingers are together. You're going to place your one arm either above your head, or if you're on the couch or chair, you can rest it on your armrest. We want to make sure that this whole area is open and accessible. You're going to take your right hand and you're going to place it directly below the armpit, and you're going to gently sweep down towards the groin. You notice I'm not moving it in towards the breast, I'm not moving it in towards the abdomen. The fluid moves where you move it, so make sure that your direction is actually where you want to move it to, which is the groin. So we're going to do 3 to 4 pumps going all the way down the side. And again, this should be done skin on skin. And we're going to do those 3 or 4 pumps all the way down, and we're going to repeat that 8 to 10 times. Now you see again, I'm going straight down the side of the trunk. You can also reach behind as far back as you can and get the back area here. If you have a hard time reaching the back area, then you can have someone help you with that. Or you can use a dry brush, for example, or even I've had some people and they use a mini paint roller to be able to reach back there if they don't have someone that can help them, or if you have that at home. So after we do that for 8 to 10 times, moving down the side, then we're going to move across the chest. So taking flat hand, fingers together, you're going to move from the left side. Again, we're working on the left breast. We're going to pump that across to the opposite armpit, so to the right armpit. You can either do this with more of this pumping movement, making sure you get from the armpit all the way across to the other armpit, or you may find it easier to use your right hand and kind of pull it across. But again, you want to make sure you're getting all the way from armpit to armpit. I even have some people and they'll start with the right hand and then they'll finish with the left hand. Sometimes that just makes it feel a little bit easier. It's a little bit more comfortable to do than using one hand. So again, we'll do that 8 to 10 times, just pumping across. Position-wise, the top of my hand is at the collarbone, bottom of my hand is right above the breast or chest tissue, and we're pumping across. This should be kind of gentle movement, but you don't want it so light that you're barely touching the skin. You just want to make sure that you're getting enough traction that you can feel the skin and upper part of the tissue moving underneath your hand. So we're going to do this again 8 to 10 times. You can certainly do it more than 8 to 10 times if you have a lot of swelling in this area. 8 to 10 again is just the minimum that we want to do. And again, if that's uncomfortable or challenging, you can start with one hand and then use the opposite hand to finish. Start with one hand and then use the opposite hand to finish. So it's just whatever feels most comfortable for you. You can also use a dry brush for this massage, just doing the same exact sequence, same movements and directions, nice slow movements. We'll go ahead and do that one more time, coming across the chest. And so now that we have opened up the lymph nodes in the armpits and the groins, we've kind of created these pathways or roadways, if you will, to get that fluid to start to move. Now we can start working on the breast. So when we look at the breast tissue, I want you to imagine that you're cutting the breast in half. And so the inner part is going out to the other side. So the inner part of the left breast is coming to the right armpit. And then the outer part of the breast is basically coming out to the side and down. So again, if we think about these as kind of roadways that we opened up, we're moving them from one area, getting on that on-ramp and moving out to the other side. And the outer part of the breast, we're getting on the on-ramp, we're coming down the trunk this way. Additionally, when we massage the breast, think about it in top and then bottom. So we want to massage the top part out first. We want to drain that, and then we're going to work on the bottom half of the breast. And then same thing with the outer part, we're going to work on the upper part, get that drained out, and then we're going to move to the bottom part. If you have fibrosis or hardening of these tissues, you can give more firm pressure and almost kind of like a deep massage, kind of a J movement or a C movement, getting that tissue a little bit softer, and then you'll finish with that lighter lymphatic massage. So to show on myself, again, we're splitting the breast or the chest in half at the nipple area, and then we're going from top to bottom. So you're going to take flat hand, you're going to start to move that up and over. So we're getting on that on-ramp. Again, everything at least 8 to 10 times. You can certainly spend more time here. The pressure should be, again, light but firm enough that you're getting a little bit of tissue movement with the skin and the tissue directly beneath it. Once we finish the top part of the inner part of the breast, then we're going to move to the bottom part. You're bringing that up and over as well. Now, I'm showing you this massage in sitting. You can also do this massage in a recliner chair or with some wedge pillows underneath you if you're lying down. With your chest and upper body elevated, that's going to help drain the fluid and help facilitate that fluid reduction a little bit more than if you were just flat on your back. So after the 8 to 10 times of moving everything up, then we're going to then just kind of bring all of the breast up and over for the inner part of the breast. Once we finish the inner part of the breast, then we're going to do the same exact thing for the outer part of the breast. So again, midline from the nipple, we're going top to bottom. So you can bring your hand up, bring it across, rest it on your armchair, your armrest, and you're going to go out to the side and down. So again, 8 to 10 times. Nice slow movements. We're getting on that ramp and making sure that you're covering the entire breast area. Fingers are closed. If you have them open, then you can be missing some areas. After 8 to 10 times at the top of the breast, let's go ahead, let's work the bottom of the breast. Again, you're still moving it out and down. So we're getting onto that main pathway that we had initially opened and getting that fluid out of that breast or that chest area. After 8 to 10 times at the bottom part of the breast or the chest tissue, then you can take the whole hand, whole breast, and start to work your way back down to the groin. We don't need to do this 8 to 10 times. This is just kind of to finish up things. So you can do this 2 to 3 times going all the way back down, and then finally finishing up coming across the chest with either hand or with both hands. Again, this is just finishing up saying, hey fluid, this is where we want you to move to. After you finish going down the trunk and across the side for those 2 to 3 times, we always want to finish with that deep breathing that we started with. So go ahead, take your hands at your belly button. You're going to breathe in through the nose, out through the mouth. Give a little bit of pressure into the belly button. We'll do that 2 more times. Breathe in through the nose, out through the mouth. And 1 more time, breathe in through the nose and out through the mouth. And there you have it. All right, excellent job. Consistency is key, so make sure that if you have lymphedema, you're doing this massage daily, ideally around the same time each day. Also remember that MLD is just one part of your lymphedema management. Compression bras or different types of swell spots with foam utilized to help decrease the swelling and the fibrosis in the breast are also going to be key to managing the swelling, as well as exercises, taking care of the skin, and most importantly, working with a lymphedema therapist. Make sure that you watch my other videos for my recommendations on how to best manage your lymphedema. And if you like this video, please like it and make sure that you subscribe to my channel so you don't miss any new videos on how to manage your lymphedema.